Welcome to the Phoenix Prosperity Podcast, where wealth meets legacy. Join your host, Tim Fergestad, as we explore the journeys of Phoenix's finest to success and beyond.
Hello, this is Tim Fergestad. Thank you for joining us. Today we welcome Dr. Arielle Rubin, an expert child and adolescent psychologist focused on autism-related mental health. She blends rigorous training with a strengths-based approach to give families the clarity and confidence they need to navigate care. Welcome to the show, Dr. Rubin.
Thank you for having me.
All right. So can you tell us a little bit about the Rubin Center? When you started it and how it's working and where in the Valley is it?
Yeah, so I'll tell you a little bit about us. So we've been in practice, I would say, about 5 years now. It's been growing since then. It started as a child and adolescent psychiatry practice, actually just with my dad as a solo practice doc. He's also a child psychiatrist. And then I graduated my training and then joined him in the practice. And then since then, we've kind of blossomed and developed and skyrocketed it to bring on other doctors and psychologists and therapists, primarily focused in the autism and developmental disability space, although we've expanded a bit even beyond that. And we have an in-person office in the Tempe area around Ray and Priest in the East Valley. But what's cool also is we do a lot of telemedicine. So we see patients all throughout Arizona, from Tucson to Flagstaff, everywhere in between. So it's a mix of patients all throughout Arizona, but our location and our physical office is in that Tempe location.
Okay, that's a nice, pretty central location. Right?
Yeah, people can get you a pretty
Greater Valley.
Yes.
Okay. Yeah, and I imagine the telemed's got to be kind of a boon for growing the practice originally, but also maybe for your focus. Is that?
Yes. Yeah. So it really, we were already doing it even pre-COVID, but you could imagine it exploded beyond there even more. And then since then, it's become a pretty big standard within our practice, and it's worked really well, especially for many of our patients on the spectrum or different needs that sometimes coming into the office in a medical office setting can be a bit stressful or have its own sensory overwhelm. So for those patients, they're able to offer the telemed visits, and it's kind of nice because you get to see them in their environment. And especially some of these parents that are juggling, 5 or 6 different therapy appointments and other kids in school, it's made it a lot more convenient. So we're also able to get, good consistency and flexibility within the scheduling. So yeah, I love it. I would say even when I'm in the office, I'm doing a lot of telemed. Even when I'm there, sometimes the patients are
right? Yeah, that's a good point. Yeah, it's a different world. So, on that note, just a technical thing, I imagine it's a great way to introduce certain clients as well. But at some point, is autism a little bit like traditional exposure therapy stuff, where you eventually want to get them in person at some point?
So it depends. It depends on what their autism needs are. I have some where they're just for whatever comfort level they are, they come in once in a while. But if they're going to be out and about in other areas that might be more overwhelming, I don't push it, for my visits, kind of save the bandwidth, if you will, so to speak. But there are other patients where they actually really either enjoy coming into the office or they want that in-person experience. And so then even if they're not ready for it in the beginning, sometimes we'll kind of help them, work up to that and work on their anxiety to come in. And then I have some patients, once they come in, I have, toys and fun stuff in the office for the kids. And so they actually like to come.
Right.
Some of the adults also like to come. So it's pretty variable, in what they need, but we meet, all different needs. My biggest thing, and part of what you mentioned in the beginning, is that strength-based and neurodiversity affirming approach is meeting the patients, where they're at. So what they need, what they're ready for, and then I kind of follow their lead on that.
Okay. And how do most clients find you? Or is it do they reach out directly, or are they referrals? Can you?
Yeah, it's interesting. I would say it's about 50-50 referrals from other providers in the community. So it can be therapists, doctors, speech and language therapists, teachers as well. Sometimes some schools refer to us if a parent might ask a teacher for referral. I'd say that's about half. And then the other half is interesting is word of mouth referral. So we have, you see my neighbor, or you see my friend, or you see their kids, or my brother. And I found that that's interesting because when they come in as a word of mouth kind of closer referral, there's a little bit more trust at the beginning, kind of already, we're ready to go because it's a warmer referral. Not that the provider ones aren't, but it's a little bit different sometimes if they come from a friend or
Sure.
family they directly know versus a professional, or is a little more distance. But I'd say it's about 50-50 split between the two of those.
Okay. Okay. Sure. And it's become it's a growing concern, and people are being more vocal and sharing a lot more about it now, which is great.
Yes. Yes. And when they find a place, they're like, hey, like this place is, no judgment. They'll get you in, they'll meet you at your pace. My biggest thing is also, not being pushy, or this is the treatment that you have to do. This is the way it has to go. We don't do that. So in that environment, when one parent finds that, it kind of spreads like wildfire, like, oh, this is the place to go, that's a safe place, and all of the other judgment zones that you'll have. And so that spreads, and that's where I think a lot of our clients stay with us for a long time.
Okay. Okay. And can you speak a little bit to, do you have any subspecialties within well, I mean, because you do child and adolescent, and I think even older
I do see some
clients.
adults, if they are usually, I kind of stop around 18 college age, unless there are some extra, special needs or disabilities. And then sometimes I'll continue into
Okay.
later adulthood. Otherwise, I'll see one of the other adult docs in my practice. But to answer your question, I guess subspecialty niche, within the autism space. So I see a lot of patients that also have neurologic complications. So seizure disorders is a common one. Sometimes
Okay.
migraine. So it's called like neuropsychiatry. So a little bit of mix of neurology in there. So I see a lot of those. I would say that's the most common overlap that I see kind of within the autism child psychiatry space. Also, kids with complex neurologic medical needs.
Okay. Okay. One of my areas was studying the molecular mechanisms underlying different seizure conditions and disorders and stuff, and
Okay.
epilepsies. And I was wondering, so like 1 in 10 people will have a seizure in their lifetime, but like 1 in 10 of those will go on to have repeated ones, right? And that, have some sort of seizure disorder or epilepsy. What is autism have a higher incidence of seizure
It
disorders?
does. Yeah, yeah. So about 20 to 25% is the
Really?
current reports.
Oh,
And there's
wow, it's a lot higher than I
peak.
thought.
Yeah. We get one in, there's like a childhood peak, and then there's a second peak during puberty.
Hmm.
More common in the boys than in the girls, but yeah, it's a huge problem. Not only the epilepsy more common, but it's more treatment resistant. And there's a higher mortality rate with it. So it's a very it's an intense thing. When it
Can have a
happens.
big impact. Yeah.
Yes, absolutely. Yeah, it's huge.
Okay, interesting. Are there any misconceptions about kind of maybe what you do and what, some clients come to you thinking you can do versus
There's a
can you
lot.
speak?
Yeah,
All right. Can you speak
there's
to
a
some of the
lot.
big ones?
Well, I would say, and I know not to get too much into politics, so we're gonna do that. But general mainstream things sometimes, and ideas that certain things can either cure autism, which that's not what we do, but that sometimes comes in as a rarely, but sometimes comes in as an expectation.
Yeah.
Or on the flip side, oftentimes parents coming in that, they did something, or blame or judge me, that I
Oh,
caused this problem. And kind of with a single moment. And as you know, in studying molecular mechanisms, things are multifactorial and
mhm.
complicated, but there's a lot
Yes.
of blame and stigma out there. And so sometimes we spend a lot of time unwinding that.
Okay.
The other one sometimes is that I'm going to prescribe everybody, something, which I don't always do that. Not everybody needs medication. And on the flip side, also a stigma sometimes that if I'm prescribing a medication, that there is something wrong or bad with my child. And so sometimes stigma around, psychopharmacology
Mhm.
and medication needs for co-occurring mental health conditions. Sometimes there's some misinformation or confusion about that. And so a lot of the time we spend doing education actually in the office, just informing
Sure.
people of, the options, the evidence-based information, pros and cons. And some patients are even surprised when I say, well, what do you want to do? I'm not pushing, anything. These are the options, but it's really more of a partnership model, and they get to lead that. And that's refreshing, but also sometimes a little bit different than what they were expecting.
Right. Right. Okay. Good points. That's nice. Speaking of education, can you educate us a little bit more about sort of the range of maybe needs or symptoms or things people when they don't know they should come and see you maybe, or what are a lot of the clients dealing with where they decide they need to come and see you?
So great question. I would say the most common thing that I have clients coming to me for is anxiety. of
Okay.
different kinds. And sometimes it's obvious. Sometimes it's a kid or a teenager that is just withdrawing and not participating, or grades are going down in school. And most of the time, people come to see me when they've tried other strategies, sometimes parenting skills, sometimes trying to come out with different activities, sometimes even therapy. They've tried different things and it's not working. And a kid or a teenager is not progressing or kind of plateauing and sometimes even regressing or withdrawing. And then that's oftentimes when they come in for an appointment with me. And it just happens to be the most common thing that I see is
Okay.
anxiety and anxiety disorders. There's many other things, but that's usually underlying a big part of what I see. But it's usually some kind of change in functioning that has plateaued and they've tried other strategies. It's not getting better. And either another provider or a family member or a friend will say, gee, you should really go, see Dr. Rubin and, get an opinion of maybe what might be going on.
Okay. Okay. Well, I mean, that impacts a lot of people nowadays, particularly in this day and age with,
Oh, yes.
I don't know if it's technology or whatever, but autism and anxiety. And would you say a lot of the autistic people, clients have anxiety?
Yeah, about 70% have
Oh,
some type of
wow.
anxiety
Okay.
at some point in their lives, and it can come and go in different intensities, but it's there. It's frequently there in school, or in social interactions, sometimes at work, if they're older, but it's there. And when it's there, it's often felt pretty intensely, and they need some support with that to cope through it so they can still, get on with their lives and do what they want to
Right.
do.
Yeah. Be functional, right? Go out and
Exactly.
live.
That's
Yeah.
the
And
goal. That is the
do
goal,
the,
the life worth living.
yes. Yeah. Do the things they want to do. Um, I've read a number of Jonathan Haidt's books, but I haven't read the most recent one that I think is The Anxious Generation. Have you read that one?
I've heard of it. I
Oh,
haven't
okay.
read it, but the title definitely makes sense for something in everyday
Right? Yeah.
practice.
All right. It's on both of our lists then, apparently.
Yes.
Okay. Okay. So what are some of the bigger challenges you've had to overcome in your field and maybe as a sort of running your own practice as well, right? You have a few.
Yeah, several. Well, when you're in training, you're focused more on the clinical side of things,
Hmm.
which is very important. But then you graduate and you get into the real world, you've got to set up some shop in a location and find a system to
Yep.
see people. And so I would say a big challenge for me and something I'm growing in and still learning is, managing healthcare administration and, the business side of running a
For
practice
sure.
where it's sustainable long term and, fair for the patients and also hiring staff and all of those pieces. I would say something I'm still working on, but just a longer term challenge. It's honestly probably my biggest. The clinical, I feel pretty comfortable with. I've got my
Right.
clients, work together, we're doing our thing. So in general, I'd say that's pretty good. Maybe an internal, personal thing, which I'm always working on. To go back to your first question is, we can't always make everything better, and so I know we
Hmm.
were talking before this of doctors sometimes being overachievers and wanting to, do as much as we can. And so getting comfortable with, what the current medical and therapy tools are that we have, and also
Right.
supporting patients and families in hard times when we get kind of stuck, and that's kind of hard for me sometimes too, but there are tough periods, there's lows when the job is to be there with the patient rather than fixing it. And
Right.
that's a little
Yes.
tough because we do want to fix as much as we can. And sometimes
Sure.
we can't do that. So some of the older docs in the practice, like my dad I mentioned, he's much more zen about that than I am. He's been
Nice.
doing this for 40
Nice.
years. I'm still working on it.
Okay. I think most of us are working on that emotional intelligence. I'm a fixer, right? That's
Yeah.
I'm at that mindset as well. So it's hard to just sit and be with some people and that's plenty sometimes.
Yes.
Um, and to your other point, yeah, you guys have so much training and just in your field of study and right, it takes forever. That's a common thing I've had with my wife's a physician as well as our friends, and I see as they go through this, they first start practicing and they're all about the cases and they're talking about different issues on the medical front, and then a little while later they start talking about how the practice is run in the systems, right? And then they get into reimbursements and all the other challenges associated with it. And you're running your own kind of out of the gate, which means you're hitting everything at
Yeah.
once. It sounds extra
Yeah.
challenging.
Yeah. No, it's like opening a black box. It's like, what is this? And things are changing. And even understanding, particularly, there's not a ton of, there are some, but there's not a ton of child and adolescent psychiatry practices in the Valley that are primary insurance based. So a lot of them are private pay, which I completely understand from a reimbursement operational perspective for many reasons. But with our patient population, particularly those with the special needs and the extra financial cost oftentimes that families have for that, we try to take insurance as much as we can and take that on as a practice. But the operational levels of managing that was something I had no idea of, in training or
Sure.
how that works or how does the hospital get reimbursed?
Yeah.
It's a whole other level of things. And so there's oftentimes, conferences, education that I'm doing, meeting with other
Right.
private practice docs, even general business owners that are in medicine, but have a lot of insight into, how you grow
Right.
and scale and, make sure that you're sustainable, meeting all your operational expenses, all those kind of things is kind of my second training after clinical training.
Right. Right. They have MD, PhD programs, but
Me too.
I don't see a lot of MD, MBA programs.
Not as not as many, and honestly I think from people that I've talked to that have done those, they're great for, and you see a lot of like hospital CEOs and those type of things and the big systems, and they can manage those, but it's a different thing of also starting your own thing and kind of getting your
Right.
hands dirty from just the ground, that even a sometimes even as the education and the degrees, it's different once you actually get in there.
For
Is
sure.
a different level. I don't see a ton of, usually the MD MBAs that I see, they're doing much, bigger things.
Right.
I haven't seen a ton that are doing a small, mom and
Right.
pop practice like we're doing.
Right. They're more admin versus yeah,
Yeah. Yeah.
sure,
Or if they have a practice,
entrepreneurial.
it's like they have like 12, they franchise and it's different.
Right. Yeah, right. Okay. So what are speaking of that, what are your sort of your goals for goals for growth? Ah.
Yeah. So I would love to. Right now, we have a couple psychiatrists and we have some part-time therapists and one psychologist. But even then, our wait list for counseling is actually growing. Our wait list for psychological testing is growing. And in general, we know that there's the wait list for an average child with autism to get services, particularly mental health services, usually anywhere in Arizona from 6 months to over 3 years, depending on what part of
Holy
Arizona you
cow.
live in. Yeah,
Oh,
there's
that's messed
huge
up.
disparities that you can imagine during that time. If somebody's struggling, it's like, you need help now. And so I would love to just grow in the same areas that we're in, but just multiply, to be
Right.
able to service those and get that wait list down. So more psychiatry, more therapists, more testing. In the future, we're not there yet, but there are other autism supportive therapies like occupational therapy, speech therapy, sometimes feeding therapy. Some of the kiddos I see have a hard time eating different foods just from
Hmm.
sensory needs and those kind of things. So expanding to even, other specialties. But I'm
Right.
trying to have to pace myself because I'm still learning the insurance world of just what I have now before adding on, different types of services. So I think we'll get there and be able to offer more multimodal type services, even outside of
Right.
just primary mental health, but that's probably several years down the line.
Okay. Side note, you reminded me of food. Are there dietary sort of impacts? I mean, obviously your mental health is impacted by what you eat and so
Yes, it
forth,
is. Yeah.
but children in general nowadays, I mean, a lot of fast-acting carbs and sugars and caffeine and energy drinks and all that stuff can't help.
No, it doesn't. It's interesting. I would say the two places where I see it the most common is in ADHD.
Sure.
That it's not all of my patients, but I have some patients that really, high sugary foods, some of these dye processed foods. Some patients are fine, and some parents will say they had this, and then the next day they were, off the walls, just, super hyper or dysregulated until they, are able to kind of come down and recalibrate so they are more sensitive.
Right.
And I have a lot of patients on the spectrum, also more likely to have different GI issues, so irritable bowel syndromes and oftentimes, acid reflux, all kind of things. So that sometimes affects what they can eat without their stomach getting upset. And on the flip side, sometimes sometimes more extreme cases I have, they're only able to, because of their sensory needs, eat a couple different types of foods. So then you throw something new in there and they're not used to
Right.
digesting it, and then their stomach gets upset. So that's where the feeding therapy comes in, helping manage their digestive needs with their physical health needs and their mental health needs and all of that
Sure.
together. But I'd say, yeah, the anxiety and not anxiety, excuse me, the ADHD and the autism in my practice is most where it comes up, as well as I have some patients with just general eating disorders. That's a different realm that we manage those too.
Okay. Okay. Wow. Yeah, and balance a lot of things, including running a business.
And that too, yeah.
Okay. So what are your thoughts on, I mean, you're early on, but sort of retirement sort of goals. Do you have anything like in your line of sight yet for how to?
Yeah, well, what I would like to do, which we're not there yet, but as we continue to grow and hire more clinicians and provide more services, I would love to find a way to carve out where I still keep my core client load, but kind of pause at some point on the growth to really pause on the clinical growth to focus on the practice growth. So right
Okay.
now as I'm seeing more and more patients, some of those long-term goals that I mentioned, like adding other services and the administrative growth, not really able to fully scale that right now just because I'm more heavy on the clinical side. So at some point
Sure.
that might, flip where I go more, clinical growth minded. Or excuse me, I keep the clinical, but I go more administrative growth minded to really be able to scale and take a
Right.
step back there. Um,
Right.
in terms of
Which is how you have a bigger impact, really,
it's how
isn't
you
it?
have a bigger impact. And I would see, I don't know that to answer your question, I don't know if that counts as retirement, but for me, that's probably the closest. I don't think I would I don't know what I would do of fully retiring of, not growing the business or not seeing patients. Like I don't know what I would do. So,
Yeah. Okay. Well, some people, right? It depends, right? And I have some of my investors, for example, are in different aspects. I have dentists and optometrists and other things, and sometimes they want to grow it up and sell it to private equity, or sometimes they want to grow it up and like bring on partners. Another, right, in your case, would be other
yeah. Yeah, other
physicians in
docs.
your
Yeah.
group that and then just they buy in, and you just keep it going that way, and it's kind of your baby. It's the Rubin Center. Maybe you want to have some control and sit on the board someday.
Yeah, yeah. Oh my gosh, that would be wonderful. Yeah, it's funny. My so my one of my older brothers, he has a autism. It's an ABA agency, but a nonprofit in Phoenix area, and so they have. He is much further beyond in terms of scaling his company than I am, but he has things like a board and a board of directors and all of those
Right.
kind of things. And so you can see what happens when you have time and that development years down the road. I feel like I'm in a little bit more of the, what do they say? You're building the plane as you fly it, kind of thing. So
Yeah, not always ideal, but that's sometimes what you have to do.
that's what you have to do. Yeah.
Okay, excellent. So, here's a interesting question I like to ask people, particularly outgoing overachievers like yourself. What have you done in the last year that's changed your life?
Ooh, what have I done in the last year that's changed my
Oh,
life? Um,
doesn't have to be the last year, okay, but
yeah,
something that impactful that's
yeah. Well, I mean, I guess separate then, just separate from the practice stuff. I got married in the last year.
oh, congratulations.
Exciting. Thank you.
Yeah, that'll change your life.
So that has been it was a great wedding. It's been fun. I love my husband, but also I guess of changing your life is, you get married and then you start to think about, starting a family and the personal side of things. And then, okay, now how do I balance that with intense career stuff? That's been something I've been thinking
Yeah.
about more in the, last couple months for sure.
Okay. Okay. Wow. Yeah, that's a big one. Okay.
Yes.
Well,
That's not
congratulations
a
again.
one.
That's awesome.
Thank you.
Exciting times.
Yes.
Okay. So, um, and let's talk a little bit before we wrap things up here, a little bit more about the area impact, right? So you said you're starting to branch out into Tucson and Flagstaff, or have you always been?
By telehealth, yeah. So we don't have offices there yet, but we have been getting more patients from those areas. We've always been available, but it just seems like more are coming. We even got
Okay.
some patients from Sedona recently. I'm
Okay.
not sure exactly how the word of mouth, spreads there, but somehow just as the we have more patients and our reputation grows, it's kind of that ripple effect.
Yeah, that's some of the best clients you can get are referrals, right? Because
It's the best.
that's a testament to the service you're
It,
providing and
it
helping people.
it really is. It means a lot to me when patients trust us enough, to refer somebody else that's going through a hard time.
Awesome. That's awesome. And so you came here from Boston when you were younger, and then where'd you go to med school? Is it in Tucson?
So I went to the Phoenix campus of University
Oh,
of Arizona. So they opened up, yeah.
okay.
It had been going a couple years when I
Hmm.
went. And I want to say it was 2014 that we started there. So it was University of Arizona, College of Medicine Phoenix, and so it started as like a satellite from the Tucson campus, but then they got their own licensing, and now it's its own medical school. But it's very confusing because they're the University of Arizona.
Right. Yep. I remember that. I remember it was 2006, 7. They were
just starting it. Yeah, they had like 10 students or something like that.
Right. Which was always odd to me, coming because I'm in the biomedical field, and it was like the 5th largest metro area in the U.S. doesn't have a medical school.
Yeah.
See, it was overdue.
And now we have several. Now from beyond that, now there's the Mayo Clinic one, and then Creighton has one as well. So it's spread a lot more.
Yep. Yeah, it was needed for sure. All right. So, any big plans for the next year or two?
Well, I think continuing to, grow and scale with those extra services. We have gotten, which has been cool also in the last couple months, more adult psychiatrists. So to the point I mentioned earlier, I usually stop around college age, maybe a little bit longer if there's special needs, but bringing in other actual adult psychiatrists has been really great. We have now an addiction psychiatrist, which is awesome because that's a unique need. We have women's health psychiatrists as well, which has been great also to see some of our moms in the practice too. So kind of continuing to grow and offer more specializations and serve, not just the kiddos and teens, but the whole family. That's kind of my larger goal, to continue to do that. And separately, like I mentioned, personal goals, family growth, working on that kind of stuff too.
Yeah, you got a lot going on. It's very exciting. Yeah. Very cool. All right. Well, Dr. Rubin, if people would like to connect with you or learn more about the Rubin Center, where can they go? What should they do?
Yeah. So connecting with me, I'd say the 2 places to find me. I have an Instagram, Arielle Rubin MD, and that's if you want to learn more of autism, mental health and education, a little bit more about me there. My website, ariellerubinmd.com. And then our practice, RubinCenterPsychiatry.com. That's really where you can learn about the psychiatry practice, the different docs we have, and actually how to get an appointment with us if that's something that somebody might need.
All right. Excellent. Good stuff. Thank you very much. Thank you, everybody, for listening and watching. Thank you very much, Dr. Arielle Rubin, for joining me today and sharing your insights into autism here in Arizona.
Thank you.
Inspired by our guests? Visit PhoenixProsperityPodcast.com/guest and join us on the show and share your success story with Tim. The spotlight awaits.